Hello, everyone. It's, I guess, good evening there to you for Wednesday evening. And I hope all of you are doing well. And the CPE learning is continuing to fulfill you as you grow and learn. Tonight's topic is about dialectical behavior therapy. Dialectical. And I want to give you a definition of that. And for the acronym, I will use DBT, dialectical behavior therapy. It is a form of psychotherapy, or what we call in layman's term, talk therapy, that can assist with managing intense feelings and emotions. The term dialectical implies that two opposing things can be true at the same time. I'll repeat that. Dialectical implies that two opposing things can be true at the same time. So, in terms of therapy, this means a person can learn to accept their behavior and feelings as part of the person's life experience, but it also can also make positive changes to move forward and change unhelpful ways of behaving. So it is a way to accept the experiences and the emotions and feelings while at the same time not wanting to stay there, but to be able to grow and improve and learn how to manage those emotions better so that the behavior with others will be more acceptable. Dialectical behavior therapy is based on cognitive behavioral therapy, CBT. And so we understand and know from cognitive behavioral therapy is a person learns to be aware of their thoughts, their thinking pattern, their mindset that is not healthy, is negative, and will affect their actions and behaviors. So the therapy helps a person in cognitive behavioral therapy to learn to change their thinking by reframing, abstaining from judgment, if the thoughts are judging others, etc., where you can change to a more positive thought process, which will then change behavior. The DBT, dialectical behavior therapy, incorporates mindfulness training and learning new skills to manage a person's emotions, change behavior, and improve everyday life. The techniques taught can address powerful emotions such as sadness, anxiety, anger, guilt, and thoughts of self-harm. DBT can be an effective treatment for mental health conditions such as anxiety, PTSD, post-traumatic stress disorder, substance use disorder, bipolar disorder, and depression. So, one study showed that 77% of people with borderline personality disorder diagnosis showed an improvement in symptoms after a course of dialectical behavioral therapy. And there are 4 areas of skill set that is to be learned in doing dialectical behavior therapy. The first one is mindfulness. The second is distress tolerance. The third is interpersonal effectiveness. And the fourth is emotional regulation. So we know that when we're able to focus on the present moment and just observe our thoughts without any judgment, our feelings without any judgment, and become aware of then the mood that it leads to, also the negative self-talk that may be affecting our emotions. So as we take time to be mindful of our thoughts, which leads to feelings and moods, then we can gain more control of our emotions and build up resilience of handling daily stressors, triggers, and frustrations. So that is these 4 areas: mindfulness, distress tolerance, learning to tolerate, interpersonal effectiveness, and emotional regulation. DBT can also help a person gain empathy and compassion so that a person is not only thinking of themselves and their emotions and needs, but considering how others feel, particularly in interpersonal relationships. That means with family, friends, coworkers, teachers, all of the social relationships that we need to learn empathy and compassion. So we can learn through this therapy to remain calm in a conflict or stressful situation rather than reactive. And it's a big challenge sometimes to not react. It is human to react, and I think it takes a lot of practice and prayer and techniques that help us to have this emotional regulation. So instead of feeling at the mercy of mood swings and changes and intense emotions, the dialectical behavior therapy can help regulate feelings and have a different balanced view of the world of life and develop a positive outlook. So this, of course, will then affect everything in a person's life: their interpersonal relationships, their work, their faith, their service to others. So it has a ripple effect, and it especially helps avoid destructive behaviors, which we all want to avoid. The difference between dialectical behavior therapy and cognitive behavioral therapy is that the dialectical lasts a lot longer and is more intense and might even go through a period of 8 months to a year. So a person really has to be devoted, committed to this kind of change and growth in their life. Um, the goals of both dialectical and cognitive behavior are to recognize how our thoughts and our feelings affect our behavior. And out of that, to develop strong coping skills and modify, regulate unhealthy thought patterns. So, a big difference also is that the DBT, dialectical behavior therapy, is focused on more on how a person interacts with themselves, how I would interact with myself and as well as others, and a certain environment, a certain social environment, or academic environment, church environment. So it places greater emphasis, this kind of therapy places greater emphasis on coping and learning to be tolerant of uncomfortable feelings and emotions, and learning how to accept them, with the goal of learning new skills to manage those feelings. So very practical, a way to redirect, reframe problematic thinking, and in order to change negative behavior. So you see a pattern here. You kind of start, so you as chaplains, counselors, can go through a process of dialectical behavior therapy yourself. And it's good to, there's a way to do that with yourself. It's good to know that process, and then you can also use this counseling technique with your clients. So I've mentioned mindfulness a lot, and I'm going to talk a little bit more about that in just a few minutes. Where cognitive behavior therapy is focused on a very specific end result. For example, I want to feel less anxious at social events, for example. But dialectical behavior therapy aims to improve the overall quality of life. So it's a broader perspective and a broader goal. And maybe with cognitive behavioral therapy, there might be 5, 6 to 10 counseling sessions, therapy sessions, whereas, like I mentioned earlier, the DBT therapy often takes up to a year. And one therapy is not better than the other, and some therapists use some of both the dialectical behavior therapy and the cognitive behavioral therapy, depending on the different issues that a person is facing. Usually people do start with cognitive behavioral therapy as a choice, kind of a baseline choice for counseling, for therapy, especially for anxiety and depression, while the dialectical therapy may be more suited to dealing with emotional dysregulation, borderline personality disorder, or even self destructive behavioral patterns like cutting themselves, that kind of self harm. So I just wanted you to know the difference between the two. They're very related, similar, but one is more long term, one is more short term. One has a very specific end goal in the cognitive behavioral, where the dialectical is a broader, general, trying to produce a better quality of life with um, someone who experiences very intense emotions and has quick mood changes. So, what is dialectical behavior therapy used for? As I said, a lot uh, about borderline personality disorder. That is what it was originally developed for, to be a therapy treatment for borderline personality disorder. And it has proven effective for people with that condition. It also it's used to treat other mental health issues such as depression, ADHD, attention deficit hyperactivity disorder, by helping a person uh, have strategies to help focus on the present moment and think ahead before making snap decisions or responses that a person may later regret. So, slowing down the thinking reaction time and helping the person to be mindful of the present moment. So, another one that DBT helps with is eating disorders, because an eating disorder is an emotional disorder that affects the way a person thinks about food, eating, body image, or other eating habits. And so that lead to unhealthy conditions such as anorexia, bulimia, overweight, things like that. So, then substance abuse, which you would think it would help with that, to change the behaviors, the emotional issues that causes one to um, have that substance abuse addiction. And then post-traumatic stress disorder, that in the way that the therapy works, the mindfulness can facilitate a person to become calmer and when handling flashbacks and emotional triggers related to the trauma. So it's also best used in this way for PTSD in a group setting. So maybe we'll get a chance to talk about that if time doesn't run out. Anxiety, mindfulness can help improve mood swings and distress tolerance, self harm. So, studies actually indicate that dialectical behavior therapy can be effective in reducing incidences of self harm and thoughts of suicide. So, it can help a person understand the reasons why they're wanting to do self harm, or it can also help them find ways to tolerate distress, and reinforce, again, behavior change. Um, so, now, how DBT works. It consists of individual talk therapy, group therapy, and phone therapy that will help you learn and apply 4 skills in mindfulness skill, the distress tolerance skill, the interpersonal effectiveness skill, and the emotional regulation skill. And I am assuming with a working knowledge that most of you are aware of what mindfulness is, but there is a process a technique that you can go through to help a person become centered, grounded, and mindful in the present reality moment. And so there are skills such as observing, describing what you observe, and participating. So you observe and describe the thoughts and feelings that come up when you sit with your eyes closed and you think about, what are my thoughts right now? What do I feel right now? And you let those bubble up, so to speak, without any judgment, good or bad, no judgment. And then the how skills are: 1, being non-judgmental, allowing yourself to attend to one thing at a time, one thought at a time, one emotion at a time, uh, one thing that your body feels. So you just take one thing at a time, addressing your needs in the present moment. So after you go through this routine of what am I aware of in my thoughts right now? What am I aware of in my feelings right now? How does my physical body feel right now? Do I feel any tension anywhere? Do I feel any pain or discomfort? So you observe that in the present moment, and hopefully working your way toward acknowledging and not judging, and then letting go of those things in the moment. So it's a practice. I haven't been doing mindfulness meditation, I guess you would call it, but maybe for, I don't know, 6 years now. And sometimes it's really hard to sit quiet and still for 8 minutes, just to do that. And but the more you do it, the better it gets. And same way when you're trying to help someone else learn this kind of process. The second category, or the skill set, is distress tolerance. And these skills assist you in validating and accepting feelings of distress and pain. So we can't live in a world in a way that we could eliminate or avoid daily stressors, right? And sometimes these stressors trigger intense feelings. So you may not be able to avoid certain parts of your daily routine that causes stress, but a person can learn to tolerate distressing emotions related to an environment or a situation. So by teaching coping strategies such as physical activity, going for a walk around the school or the office that you work at, or your neighborhood, or running in place for 5 minutes, some kind of physical activity that will help the distress momentarily, and then breathing exercises, muscle relaxation techniques. Those are some of the soothing, self soothing, quick stress relief practices. Sometimes just listening to a calming song, or, if you have a pet, or something that you just want to pay attention to, and maybe stroke pet, pat the, you know, stroke the pet. I don't know about you all there, what you have, as much as we do in America. It seems like every person in America owns a dog or a cat here. So we have therapy dogs that go in schools and hospitals, and even preschools. My grandson Noah told me that the caring dog came in their school this week. So, very interesting how pets can soothe. And then the third area of skill situation is interpersonal effectiveness. And so, some people have social anxiety and they're not comfortable in social settings, situations. So, or even one on one, whatever the relationship is, learning how to express wants and needs, setting boundaries, learning to respectfully, kindly assert yourself. A person can communicate in a way that is respectful and kind, but also, being able to communicate in a way that is equal with another person, but also expressing what you need and what you want in a way that's not, I don't mean like in a selfish way. And so then on the fourth area, the skill set would be on emotional regulation. So that's the last area. There's 4 areas. And the strategies you learn in that help you to recognize, identify, and gain more control over your emotions, especially feelings that are uncomfortable, overwhelming, intense. So you learn, like with a lot of stress management, you learn to identify the triggers and then know what to do with that trigger. And that trigger that's going to have this emotional impact, and learn to respond more appropriately. It takes a lot of practice. I'm not saying that it's easy, but that's why with this type of therapy, it's more long term. And then, let's see, we have, you have group, individual, group, and then phone coaching. I think this kind of got out of order here a little bit. But the phone coaching is if a counselor, pastor, whoever would want to try to take 5 minutes to almost like be in Alcohol Anonymous, kind of like a sponsor, coaching you in this dialectical behavioral therapy. So when a person just feels totally overwhelmed and shut down, in the moment, they could call this person, this therapist that could help them walk them through on the phone. Or if a person was suicidal, or you probably have suicide hotlines there, and that's what those people do if someone calls because they're scared they're going to carry out suicide, and the counselors on the other end of the phone help by walking them through. And the group therapy it can be, excuse me, 30 minutes a week, 1 hour a week. But if a person's already going to therapy, individual therapy, then this is a double commitment. But the group process, as you know in CPE, with your interpersonal group, IPR, excuse me, um, you learn things in a group that you may not learn individual. And so it's more like a classroom kind of setting, and there's a leader and co-leader, and they develop exercises and activities for the people involved to engage in. Um, and then in this group process, like CPE, you can talk about new skills you're acquiring and the homework assignments and getting feedback from others in the group. But of course, it takes participation. And the best scenario is when everybody wants to participate and share. And but there's a lot of good things that come out of group therapy. And then there's the self-directed, and you go through all of the 4 areas in mindfulness, in the distress tolerance, things that you would do with the distress tolerance is simple breathing exercises where you breathe in counting to 4, but you breathe out much slower, counting to 7 or 8 to slow the heart rate down, the respiration rate. And then visualization. So this is a technique you learn for distress tolerance exercise if you're doing it for yourself, and you think of a scene that makes you feel happy or more peaceful, and then you go through these questions like what does, if you're saying by the beach, that's where I feel peaceful, what does the breeze feel like? Can you hear the gentle lapping of the waves, the sun, the warm sun on your face? Can you smell the salt air? So in your visualization, in your imagination, the brain is working, the mind is working, and it starts to calm, and then it calms the whole body. So, and then in addition to breathing exercises and visualization, physical movement for this area. And then, let's see, I think that's about everything. The things that I've read about dialectical says that you may not come out of this therapy with complete resolution of all the symptoms, and you definitely have to stick to a structured format. So, and if a person can, to definitely do group therapy and individual therapy. So, if I were with you in person, I would want to know how practical this would be for you there in your setting, in your culture, your schedule. But definitely, I would recommend trying to go through a self directed therapy in these areas that I've mentioned, the 4 areas. So, um, if you have any questions, as usual, or any comments, then please message me, Facebook message me. And this, I will be honest, this is not a directly a therapy technique that I have used in its full course. I mean, I use parts of this in cognitive behavior therapy counseling, but I would not say to any other person, oh, I'm an expert in dialectical behavior therapy, because it ties into cognitive behavior therapy. So I hope this has been helpful, and I pray for you tonight that whatever your needs are, that God will provide for you and bless you and Chaplain Nato and the whole program and ministry. So God is good all the time. All right, take care. Good night.